Good afternoon, guys. Welcome to NMS. This is video series 2, time restricted eating only for weight loss. So in other words, no other measures, just time restricted eating. What does it do for people and what are the limitations? Okay, so what happens with only time restricted eating? Without calorie counting, it can lead to weight loss even in people who are not explicitly limiting calories. Patients with type 2 diabetes in the 6-month trial lost approximately 3.5% body weight using just an 8-hour window. Improvements in metabolic markers, including obviously HbA1c, accompany weight loss without calorie counting. In particular, HbA1c improvements in diabetic subjects. In other words, people who are already type 2 diabetes or even type 1 diabetes. So calorie restriction doesn't seem to produce large additional benefits when calories are already restricted. The NEJM trial, which was 12 months, showed that time-restricted eating combined with calorie restriction produced slightly more weight loss, but not statistically significant. Longer durations of greater than 6 to 12 months generally show modest sustained benefits, but the effects are not large. Maintenance tends to plateau. Time-restricted eating without calorie counting often leads to results in spontaneous calorie reduction, which helps, but once adaptation happens, additional weight loss may slow or stop. In other words, there is a limit to how much weight you can lose on this type of method. There is plateauing. So what happens with only time-restricted eating? With some of the large trials also show that calorie restriction may be easy to maintain or sometimes perform better depending on the individual. In other words, you limit your calories, okay? You're not just doing time restricted. Adherence is decent in many of these studies, especially when the eating window is moderate. Example, 8 to 10 hours, and doesn't require extreme fasting. But long-term adherence over multiple years remains less well tested. The unknowns. The evidence is less clear for multi-year outcomes like 2, 3 and 5 years of time-restricted eating without calorie monitoring. Is weight loss and body composition sustained long-term? Do different window timings, example earlier versus later, matter for long-term metabolic health when calories are similar? The effects in different populations, for example, age, sex, pre-existing disease, lean versus obese over long term, or whether time-restricted eating has risks or unintended effects in the long term for lean mass, micronutrient intake and hormones. So in summary, TRE works in the short and medium term, or time-restricted eating, for modest weight loss. There are some metabolic improvements for glucose control. It works by reducing the eating opportunities, leading to eating less without counting. Beyond 1 year, the benefits are modest and show no advantage to standard calorie restriction diets. There are no extra losses when combined with calorie restrictions, and weight loss tends to plateau. In other words, what happens with this, guys, is that eventually your body adapts to the calories that you have, or people adapt to calorie restriction or to the time restriction by then going and eating more in that window. In other words, they're adapting their food to the smaller time frame that they've got to eat. Okay, so just remember that, guys. Long term, this actual time restricted eating may not have much more benefits than having a calorie restricted diet. Thanks for listening, guys. Look out for my video 3.